Did you know that 7 out of 10 Americans who have medical bills say that they have to lower their spending on food in order to avoid a medical bankruptcy? Navigating our highly complex world of healthcare and health benefits leaves many people feeling like a snowball in, well, you know where. I'm Josh Butler, healthcare consultant and advisor to more than 150 employers around the country, and this is A Snowball's Chance in Healthcare, a show about restoring hope in healthcare. Join us as we discuss ways you can lower your healthcare and benefits costs, how companies are winning the healthcare and benefits battle, and how hope is being restored to this community and communities across the country. Good morning, everyone. Welcome to another edition of A Snowball's Chance in Healthcare. I'm Josh Butler, your host, and I'm also the president of Butler Benefits and Consulting. We are a local healthcare consulting and brokerage firm, and this show is all about reducing healthcare costs and mitigating risk and giving people a snowball's chance in healthcare. And each week we discuss specific strategies about how to lower healthcare costs, how to improve quality, and we talk a lot to employer groups that sponsor health insurance plans. 65% of the country still accesses our very complicated healthcare system via an employer-sponsored health plan. So we spend a lot of time talking about that. And last week we had a Dr. Moore was our guest, and we talked a lot about direct primary care. And this week I'm equally excited to have a friend and partner in crime, so to speak. Mike Grant is the CEO of the Surgery Center of Amarillo. Welcome, Mike.
Hey, thanks, Josh. Thanks for having me. Excited to be here today.
You bet. And today we're going to talk about your surgery center here because the Surgery Center of Amarillo is what we call an ambulatory outpatient surgery center, or an ASC. And not a lot of employers, especially self-funded employers, we're going to just have a conversation and, talk about what you guys do over at the surgery center. But not a lot of people know about the cost differentials and the quality differentials. We're going to dig into that. But tell us how long you've been with the surgery center. How long has it been up and going, and what kind of surgeries do you guys kind of perform over there?
Sure. So Surgery Center of Amarillo, we opened November 1st of 2017, so we're going on 5 years. And we're as Josh said earlier, we're a true outpatient ambulatory surgery center, which means we can keep people and patients 23 hours or less. So everyone has to go home, within 23 hours. Traditionally, most patients go home the same day of surgery, so they go home the same day they have their surgery. And we do a lot of different specialties. There's a couple outpatient ambulatory surgery centers in Amarillo, but most of them are single specialty. We're the only multi-specialty ASC, or ambulatory surgery center, in town, and we do everything from bariatric and weight loss surgery, general surgery, which is your hernias and gallbladders and surgeries like that. Colon and rectal surgeries. We do endoscopy, so EGDs and scopes. We do neurosurgery and spine. We do orthopedic surgery, focusing mainly on orthopedic hand cases. Sports medicine, which is your rotator cuffs, ACL repairs, knee scopes. And we do total joints as well, so knees, total knee replacements, total hip replacements, total shoulder replacements. And we also do cardiology, focusing mainly on pacemakers, defibrillators, and changeouts of pacemakers and defibrillators. And then we also do pain management and podiatry. So a lot of different specialties. I think we do 9 different specialties, and any case that can be done outpatient and send the patient home the same day is cases that we do.
That's amazing. I mean, so it's not just, one type of surgery that you specialize in. So that's great. So one of the things that we partner together, we send a lot of patients and refer a lot of people over to the surgery center. And we want to tell a couple of stories because, this show is about, how self-funded employers and how even individuals can save a tremendous amount of money by utilizing the services over at the Surgery Center of Amarillo. And so it kind of started with a couple of patients a few years ago that reached out to us. And I want to tell a quick story because this was an amazing story. A gentleman had come to us, and he was insured under a health plan at a company that was, at that time, not even our client, but they had a very high deductible. It was like a $7,000 deductible. And he had come and he brought his wife over to my office, and he had had an umbilical hernia for 10 years. He had suffered, he had this umbilical hernia, and he was just never able to afford to get it repaired. And so in about 10 minutes, I wheeled my chair around and I called Mike on the phone, and in about 10 minutes, we had a deal worked out. And when I hung up the phone, his wife was just in amazement. She said, "We're getting this done. It's time. It's been years and years and years." And so, Mike, I mean, you guys handled that. He was in the OR within a week. He had a surgery that I believe we ended up paying a total cost for. And we're going to talk about a bundled procedure of $3,400 is what we got this. He had been quoted prices in the neighborhood of $18,000, $14,000 for this umbilical hernia repair. And over at the Surgery Center, we were able to get that bundled at $3,400. So, Mike, tell the audience, that these people that are listening, number one, what is a bundled procedure?
Sure. So a couple things. So a bundled procedure is your facility cost, basically, which is the location that you're having your surgery done at, the physician's fee, which is the professional fee component, so the doctor doing the case, and then the anesthesiology bill or anesthesia bill, and then we actually bundle it even more, and we add your lab work and any necessary stuff that's needed prior to your surgery testing or anything like that to the bundled price. So it's really a bundled price. That's your physician, anesthesia, facility, and lab work fee all in one. And what most people don't understand is your physician fee is the same, whether that physician takes it to a local hospital, a surgical center that's a surgical hospital, an outpatient ASC, the physician gets paid the same. The anesthesia provider gets paid essentially the same no matter where it's happens at. The main difference in where the cost variances occur is the facility side. So if you have a hospital and it's a hospital and you're getting billed at inpatient rates, let's say that's $1. Well, if you do something that's hospital outpatient and you go home at a hospital the same day, that's 70 cents on the dollar. If you go to an outpatient ambulatory surgery center, it's about 35 cents on the dollar compared to that hospital. So 35% or a 65% savings to have the exact same thing done at an ASC, an outpatient ambulatory surgery center. And so with that being said, you can save a ton of money from the facility side going to any day surgery center. And then, there's a lot of advantages of hospitals and surgical hospitals, but at ASC, if it's a surgery that you can go home the same day, it makes sense to go to the most appropriate location.
And because of, like medical advancements and technologies and just becoming more proficient in things like orthopedics, for example, that's just one subspecialty that you guys deal with, is that more and more surgeries are being shifted over into the outpatient setting, correct?
Correct. Yeah. So a couple of years ago, total knee replacement got moved by Medicare, even for Medicare patients 65 and older, that got moved to being done outpatient. And you see that trend across the country. Total knees are going home the same day. When we first started doing total knees, and in our facility, Surgery Center of Amarillo is the first facility in Amarillo to get a surgical robot for orthopedics.
Awesome.
And we did the first outpatient robotic total knee replacement in Amarillo. And I think the first couple we did, we kept the patients for about 8 to 10 hours for observation. And now I think we send patients on average home around 3 to 4 hours after their surgery. And we do a nerve block, a regional nerve block before every case almost. I mean, not every case, but primarily all the bigger cases. We do a regional nerve block. And that's really, and we use a long-lasting anesthetic agent, a topical anesthetic agent that helps block that pain for 48 to 72 hours. So most patients are in a good spot and they're ready to be discharged and go home and feeling pretty good about 3 to 4 hours after surgery. So.
That's great. We're going to talk about quality a little bit more here in just a minute, but let's back up for a second. I want to go back to this bundled pricing because I want employers and HR managers and the people that are sponsoring health plans and especially self-funded health plans to really I want them to appreciate the efficiency that's generated within healthcare when you do bundled services. So if you think about in a status quo health insurance plan, everything is very siloed. The surgeon sends a bill, then the facility sends a separate bill, then the anesthesiologist sends another bill, and maybe the company that charges for durable medical equipment, what we call DME, they send a different bill. And, there's like 4 to 5 different bills that get sent to a health plan in order for claims to get paid. That's like going to buy a TV, right? Imagine going into Best Buy and you go buy a TV and you're like, okay, I want this Samsung that's hanging on the wall. And there's a charge for the TV, and then there's a separate charge for the remote control. Then there's a separate charge for the power cable. And, there's a separate charge for, this. That's not how we buy things. Everything else that comes with, they're bundled. And so this creates efficiency in healthcare. And this is one of the ways that we drive down administrative cost of a health plan, is that we are just making things easier to bundle, easier to purchase. So do the doctors mind? Do your surgeons mind? Do the anesthesia? Do all these players that have something to do with the total knee replacement, do they mind that the surgery center bundles this rate and then they get paid by you guys?
No. So what we do is we come up with a transparent. It's on our website. You can go to our website, surgerycenterofamarillo.com. And there's even more procedures that we could put on there. It's just we've put the top 10 to 15 cases that we do in each specialty, or procedures that we do each specialty. And we have an upfront, transparent, bundled pricing. And if you're a patient, and let's say, that's you need a knee replacement. That's a significant amount of money. So, $16,000, you can just, and we offer a lot of financing options as well. That other locations don't offer. So you write one check to Surgery Center of Amarillo, and then we pay the physician for you, we pay anesthesia for you, we pay your labs for you. So you only have one bill you pay, and we pay all the providers and all the necessary other things needed for your surgery for you, and you don't get any bills from us. The physicians and anesthesia providers don't have to submit a claim, then deal with billing it, talking to insurance. Their staff appreciates it because it's one check, and we pay all our providers that we do for all the upfront bundled cases once a week. We pay all the providers, so they're getting their bills paid once a week.
Now, let me stop you, because you just used a couple of figures there, $14,000 or $15,000. Now, for those of you listening in the audience, we've been using this example of a total knee replacement. That's a DRG 470 for those of you that like to geek out on medical terminology, but that's a total knee replacement. So you just rattled off a figure, $14,000 to $15,000. Is that about your price point for a total knee?
I think we're 15 or 16,000.
So 15 or 16,000, and so everybody has an appreciation for that, and that's a bundled rate, right?
Correct.
15 to 16,000. That's all in. That's everybody paid. Well, what would that run in a hospital setting, or in not an ambulatory multi-specialty surgery center? What do you think? I can answer this question, but I can tell you what, because I look at a lot of claims data, and I know, like, for people that are with Blue Cross Blue Shield or United Healthcare or Cigna or Aetna or Humana, I can tell you what the contracted rates are for that total knee, but you take a crack at it.
I would say just the facility on average is going to be anywhere from $28,000 to $42,000, just the facility. And then you have to pay your anesthesia provider and your physician and labs and all that, and DME, and our bundle pricing, I think, is $15,000 to $16,000.
Yeah, most major carriers through their PPO networks are paying, not build charges. They're paying. I've seen some as high as $46,000, $50,000 for a total knee. Most of them are averaging right around $38,000. Is some of the average pricing that I've seen. So this is why it's relevant to employers, especially if you're self-funded. And we're going to talk about quality here in a minute, because, Mike, a lot of times when I go have these types of conversations with employers, they're like, how are you able to save so much money on these procedures? Are you sending people to Tijuana, Mexico? No offense to Tijuana, Mexico out there. Or, I mean, what's the OR look like? Is it a storage unit over, somewhere in Amarillo? And so let's talk a little bit about the quality, because I think for a lot of folks, it's counterintuitive that if something costs so much less, you got to be skimping on quality.
No, it's just how we're licensed. So we're a licensed ambulatory surgery center. We can only bill a certain amount of, what Medicare would pay for that same service in an outpatient ASE. So we're Medicare licensed, just like the hospitals or surgical hospitals are. We're accredited with AAAHC, which is really the gold standard accrediting agency, that or JCO, for outpatient ambulatory surgery centers. So we're fully accredited. We're Medicare accredited. We're state of Texas accredited. Our operating rooms are actually a foot by foot larger than the largest integrated room at one of the local hospitals here. We have state of the art, all our technology. We've only been open for 5 years. All our technology is less than 5 years old. Yeah,
that's
everything we have is up to date, state of the art facility. And we do a lot of things even different for patient care that's even better, quality indicators than some of the hospitals. So
that's awesome. And one thing I really appreciate you guys is, like, a lot of times when we send people for second opinions or to come get, an obs or maybe take a look at getting a second opinion with the Surgery Center of Amarillo, you guys will even let them tour the OR and tour the facility and check it out, because we want people to feel comfortable that, yeah, it's going to cost a heck of a lot less, but you're in a safe environment. You're in a sterile environment. You're in a high-tech environment. It's the quality of this place is pretty amazing.
Yeah, absolutely. And we've got phenomenal staff, our nursing staff, surgery staff, recovery staff, even insurance and pre-admit and the front desk staff, phenomenal staff, some of the best staff here in Amarillo. And we don't cut any corners on surgery. I mean, we treat every patient that's like our family member or our loved one. And we try to treat people like people, not like you're a patient that's just getting kind of, moved through the process. And we really do try to treat every patient like that's your family member and your loved one.
That's awesome. Where's the nearest? You mentioned a minute ago that the Surgery Center of Amarillo is the only multi-specialty outpatient ASC in Amarillo, which you are. Where's the next nearest?
So there's one in Lubbock. There's a ASC in Lubbock that's multi-specialty, but I don't think they offer as many specialties as us. So outside of Lubbock, we're the closest one in a couple hours. So.
Yeah, we know that there's our friends are over in Oklahoma City as well, with the Surgery Center of Oklahoma. They're good friends of ours. One thing that we would mention here is a shameless plug is we do a lot of work with the Surgery Center of Amarillo. They're a good partner here. They've helped a tremendous amount of our clients, a great number of our clients, greatly reduce the cost of outpatient procedures. But if you're listening and maybe you've got employees in other places of the country, maybe Amarillo area is not the only place that you have. That's why I bring this question up, is that at Butler Benefits, we partner with ASCs that are very similar to Surgery Center of Amarillo all across the country. We just did a deal last week that we contracted with 3 ambulatory surgery centers in Tennessee. So, I mean, if you've got employees in Tennessee, holler at us. We've got connections all over the country with ASCs. But the other thing is that you had just kind of touched on a few minutes ago is on quality. Just let's kind of get back to that a little bit. You guys started out with just a handful of surgeons. How many surgeons now work and are credentialed and have privileges over at the Surgery Center?
Sure. So we have 12. We're physician-owned, so we're owned and operated by 12 physicians that are here local to Amarillo, some of the best physicians in the Amarillo area. And we have 14 physicians that operate routinely and regularly at our facility, but we have 26 physicians credentialed at the facility. So all local physicians that are from Amarillo live here, and we do a lot of different kind of surgery. So
yeah, excellent. Well, if you were talking to an employer directly, because I know that that's kind of what this show is kind of, what would you say to them? Is especially if they're self-funded, or how do they go about coming? You take several different types of insurances, right? You're not just cash based, so you're not just for cash pay patients. You are in network with a lot of different insurance companies. Let's talk about that for a little bit about. Well, do you take my insurance? Do y'all take insurance? Let's start there.
So we take insurance. So we're in network with all the major insurance companies in town: Blue Cross, United, Cigna, Aetna, Humana, First Care, Baylor, Scott & White. So almost every insurance plan we accept. And why that matters to you, so let's say you've met your deductible, but you have a high max out of pocket. If you're paying 20% of $10,000, that's $2,000 as your patient responsibility. If you're paying 20% of $2,000, that's $400 for your patient responsibility. So we give patients quotes and estimates all the time. All the time, they're totally shocked by how much they owe at our facility versus some of the local surgical hospitals or local hospitals. And, where you have surgery matters. So not everything can be done outpatient. Not every patient is an ideal candidate for same-day surgery. So a lot of it depends on, how healthy that individual is, how big and extensive their surgery is. But there's another business that we here in town that has a lot of employees, pretty large organization. We looked at their claims and their data, basically, and roughly about of their surgeries and their procedures that were done, we could do about 70% of their surgeries that they had done outpatient. In about a 2-year period, we looked at all the things that were done, and we'd be able to do about 70% of those procedures outpatient. So
and save them all kinds of money.
Of that 70%, we're saving them 50 to 60% on that cost.
Yeah. So two things that really stand out to me here is that what a concept. You're giving people. You post prices online, and so. This is something that, we've talked about frequently on this program about healthcare is one of the only things in the U.S. economy I can think of that we all purchase at some point before anybody knows the price or the quality. Yeah. That's not the case at Surgery Center of Amarillo. So you said a minute ago that y'all post a lot of your prices up front online. You can go to their website. What's the website again, Mike?
SurgeryCenterofAmarillo.com.
SurgeryCenterofAmarillo.com. That's simple enough, right? Yep. And they have all kinds of listed procedures, and that's the price you pay. What a concept. Yep. That now you're able to shop for so many different outpatient procedures. And so that's the first thing. And then the second thing, I want to tell another real quick story that you guys, and why we've built such a strong relationship with y'all, and that we rely on you guys to treat our patients right, treat our customers right. I've had multiple people we've referred to you guys that came for a second opinion after they had already been told, yep, you need to have a surgery, okay? That when they come for a second opinion and they get a second evaluation with y'all specialists, they didn't even need surgery, okay? Now, to me, because I think a lot of people would prefer to avoid surgery at all costs if it's absolutely not necessary. And so you want to talk about saving money, folks. How about, not just the difference between what a knee replacement costs at their center versus a hospital setting, but look at the cost savings when a person doesn't even need to have the procedure. And so I've had so many people that have come to me and said, thank you so much for recommending that we go get a second opinion, because then it ended up they didn't even need surgery.
Yeah, absolutely. And we've been pretty strategic with the physicians and the physician partners that we've, worked with. And I feel like we're always trying to be upfront and transparent. And, we've sent several of the people that you've sent over, and the physicians looked at their x-rays or their MRI and said, hey, we think we could be able to get you back to normal with physical therapy, aggressive physical therapy versus surgery, or surgery may not be the best option for you. So I feel like our physicians are going to do the right thing, and the right thing for each patient. So.
Yeah, I mean, it's obviously been our experience, and we wanted to say thank you to you guys for that. If you're just joining us, we're talking with Mike Grant. He's the CEO of the Surgery Center of Amarillo. It is the only multi-specialty ambulatory surgery center in Amarillo, and they are kind of ushering in this new model of posting their prices up front for all different types of subspecialties, all different types of surgical procedures. And so our message today, if you're just joining us, if you're a self-funded employer in particular, or if you're a larger employer, your claims matter. What you pay for healthcare services matter. And so it begs the question, if you have an employee that's facing a total knee replacement, do you want to pay $40,000 for that surgery, or do you want to pay $16,000 for that surgery? I mean, that's kind of a no-brainer question, right, Mike? But so let's get back to this conversation with employers before we wrap up here at the very end. So when we go out into the community, we're having these conversations. How can they be more proactive as self-funded employers to steer their members or to recommend that their people come to your facility?
Yeah. So I think some of that's working with people like Josh, and not to toot his own horn, but he's done great about, let's say it's a self-funded, an employee that works for a self-funded group. If that employee has a $2,000, $3,000 deductible and they go to our facility versus going to a hospital, and let's say it's a total knee and it's $16,000 versus $48,000, so a third of the cost, the employee will then have his deductible waived. The employer will pay that $2,000 of patient responsibility because they're saving so much significant amount of money that the employee's happy because he's not having to pay his deductible. The employer's happy because if you're self-funded, you're paying for that claim. So it's a win-win for everybody. So I think writing your plans, if you go to certain facilities, baking it into those plans, if you go to certain facilities that are in network with that self-funded plan to save money for the employer and the employee, it's a win-win for everybody.
Absolutely. Employers need to know that, not all health plans will accommodate that level of flexibility. You talk about waiving deductibles. We've told stories here when we've talked about high-cost prescription drugs and how we're able to source medications at a fraction of the cost, that the employer's happy to pay the whole tab because they just saved $40,000 on a knee replacement. So you have to have a certain plan design in order to accommodate those types of strategies. One solution that we know of is High Plains Health Plan. We just launched High Plains Health Plan this year. Mike, I know that you guys offer a similar plan for your employees that provide those financial incentives that when you choose high-quality, low-cost care, we can eliminate the members, the patients, deductibles, and out-of-pocket. And so we're generating value for not just the clinical community, but also the employer community, that they can start to design health plans that deliver a tremendous amount of value to those people. So we're getting close to wrapping up here, Mike. Last words. Tell me why people need to come to Surgery Center of Amarillo one last time.
I would just say, where you have surgery matters, especially if you're a self-funded, employer group, or you have a large, high deductible, and large or higher amount of max out-of-pocket. where you have surgery matters. So you can have that same surgery. Let's say it's a gallbladder, or they're taking out your gallbladder. It's called a lap chole. Where you have your surgery matters. The physician fee is going to be the same. The anesthesia fee is going to be relatively the same. Everything's going to be the same except for that facility. So that facility fee, on average, we're 30 to 40% of a hospital, less than half of a outpatient, or day surgery at a hospital or at a surgical hospital. It can save a significant amount of money going to a true outpatient ambulatory surgery center from a surgical hospital.
Awesome, Mike. Well, hey, thanks so much, my friend. It's been a pleasure having you. Mike Grant, CEO of the Surgery Center of Amarillo. And I'm Josh Butler, president of Butler Benefits and Consulting. And each week we're arming employers and families with information like this right here to give you a snowball's chance in healthcare.